फ्रेंड्स, आपका स्वागत है टारगेट एम्स जोधपुर चैनल में। आज हम पढ़ेंगे साइकेट्रिक नर्सिंग का एक क्विक रिवीजन, लास्ट मिनट रिवीजन नोट सेट के लिए करेंगे, है ना। साइकेट्रिक नर्सिंग क्या होती है? साइकेट्रिक वाज कॉइंड बाय जर्मन फिजिशियन। जो साइकेट्रिक है वो किसने दिया था? कॉइंड बाज जर्मन फिजिशियन जॉन क्रिश्नर रॉयल। किसने दिया था? जर्मन फिजिशियन थे एक जॉन, जिनका नाम था जॉन क्रिस्टियन रेल इन 1809। कब आए थे वो? 1808 में। Psychiatric word is taken from psychiatric word is taken from Greek word which have psycho means soul and itrix means होता है medical treatment. Psychiatric is the branch of medical that deal with mentally illness, diagnosis, treatment, prevention, and rehabilitation of disease. Health is a state of complete physical, mental, and social well-being, and not mainly the absence of disease. Mental health is the adjustment of the body, mind, spirit with the environment. According to WHO, mental health is the stage of the well-being in which individual relies on OWN on abilities can copies with normal stress of life that can work progressively and able to make contribution to his or her community. Psychiatry is the scientific study of human behavior. Wilhelmus Holt is known as the father of psychology. Any human response to stimuli is known as behavior. Averageness, ये क्या है? Awareness about self, time, place, person is known as consciousness. Any physical movement carried by person is known as psychomotor activity. Thinking in mental process that deal with the idea and thought. It has 3 levels: a formation level, progressive level, and control level. Where is experienced by a person thought senses. Sense organ is known as perception. Visual perception is seen in of sight. Auditory perception is seen of hearing. Olfactory perception is seen of smell. Gustative perception seen in the taste. Tactile perception seen in the touch. Ability of a person to make considerable decision is known as judgment. Awareness of inner self in the side of the person. Memory is the capacity of a person to retain, recall, and remember of learned behavior. Attention is the short time focus on stimuli. Concentration is the long term focus on stimuli. Inner feeling of a person which expressed by gesture, posture, facial experience, and tone, volume. Pressure of speech is canoes emotion. अफेक्ट इज शॉर्ट टाइम, उसको बोलते हैं इमोशन. अफेक्ट इज शॉर्ट टर्म इमोशन. मूड इज लॉन्ग टर्म इमोशन. सर बेंजामिन रस is Cano as father of American psychiatry. Modern father of the psychiatry is Philip Pina. In 1912, for a symptom of schizophrenia were given by Yuval Lever. In 1927, insulin shock therapy developed by Sneckel. 1938, ECT was described by Euro Salatin and Luino Beni. In 1949, Act Manic Drug. In 1959, Act Manic Drug lithium use first line treatment by acetylcholine psychiatric John Cord. 1952, first antipsychotic drug chlorpheniramine was used. 1957, was first antidepressant drug imperimine was used. In 1965, psychiatric subject में Maud Mandary from BSc Nursing by INC. In 1975, MSc Nursing started first by RAK College of Nursing, New Delhi. 1986, psychiatric subject include in Gram by INC. On 22 मई 1987, Mental Health Act was passed. Delirium in the disorder of consciousness characterized by cloudy of consciousness. Delirium is the disorder of memory changes by impaired in memory. In 1896, Emil Carifilian said schizophrenia is dementia precoce. Phobia are irrational fear of any stimuli. Fear is any unpleasant reaction to a real danger. Obstruction या obsession are unwelcome idea which come into the individual in mind again and again. That person want to remove this idea but cannot success, and this is anxiety produce. Obsession anxiety is relieved by confusion activity. Obsession is to disorder of thought where composition is the disorder of activity. If both parent affected by mental illness, then there is about 40% chances that their children get mentally illness. If single parent is affected, then there is a 10% chances to get mental illness. Introverted, self-contained person may be developed depression in their life. Introverted, experienced social person may be developed name is their later life. Extend disinfiliated person may be developed observation their life. Melancholious. Obstruction Manitonian socially isolated with sad moon person may be develop depression in later life. Lack of color, mindness is cloudy of consciousness, confusion is lack of awareness about TPN, time, person, place. Sputter is a condition in which patient is activity level and speed reduced to minimize level. Coma is the stage of prolonged unconsciousness. Patient eye remain open in coma visual. Increased psychomotor activity is the sign of mania. Waxy flexibility is the stereotype position in which patient maintain constant position without any movement. There is a cano as a cataplexy. It is a disorder of activity. Mannerism is the disorder of the stereo, ser- stereotype activity in which patient represent any movement without any purpose. Example: white collie roll but will breathing. Bathing. Verbicration is the stereotype speech in which patient repeated word or sentences without any purpose. It the disorder of activity. Paralysia in the condition in which patient repeated speech of self. पैरालेलिया पैरालेलिया का मतलब क्या होता है? पैरालेलिया इज द कंडीशन इन विच पेशेंट रिपीटेड रिप्रेजेंट्स स्पीच ऑफ सेल्फ. इकोलेलिया इज द repetition of speech that is limited by patient in order of the activity. Echopraxia in the disorder of activity in which patient represent activity that are limited. Negativism is the condition in which patient is aware of stimuli but given response upon or a negativity. Suicide disorder of activity in which patient act of kill and self. International using of physical force to hurt or kill other is canoes violence. Immigration coordination and creating of thought and idea result in formation of the thinking. Ideas and thought are intercoincident with other ideas result in progressive of thought which a patient person with trained self into the self created world. Fantasies word is canoes thinking. Autistic thinking. Foul of idea is repeatedly quickly shift from one to another without any conception, but between this is loosening of association. Flow of idea is repeatedly quickly shift from one to another without any conception. Without any connection in between. This is loosening of association. Flight of idea is repeatedly shift from idea from to another, minimize concession. When a patient person speaks some pronation word repeatedly is clang association. Thought retention means person make very lows this or idea is response of any stimuli. This thought Thought prevention means person given some response to different stimuli which may be right or wrong. Thought blocking is the condition when ignition or progressive of thought are normal, but there is sudden sponges of thought of the point which a person tell more necessary thinking and release it answer it last is known as circumcibility. When a person makes unnecessary story and never given answer to the stimuli is known as a cognitive ट्रेंजरिटी। इसके आगे हम पढ़ेंगे कल। थैंक यू सो मच।